This is session 105, the thyroid. The thyroid is a key player in the hormone balancing program. The thyroid is positioned in the neck as the communication center between the command office, the brain, and the workforce, the body. Not only does the thyroid pass the brain's commands on, it also transmits valuable feedback messages from the body to the brain. However, there are a few misconceptions and pitfalls about thyroid function that you need to be aware of. The thyroid affects every system of the body. It increases energy, increases fat burning, and controls weight, increases the heart rate, affects the appetite, helps bowels to work properly, helps the menstrual cycle to be regular, keeps the hair and skin healthy, and is related to our mental health. Let's start with the basics. The thyroid's hormones are T1, T2, T3, and T4. Only T3 and T4 are significant for our discussion. T3, the thyroid protein with 3-iodine, is the active form of the hormone. It does all of the work. T4, the thyroid protein with 4-iodine, is the inactive form of the hormone. In general, when a person with a properly functioning thyroid wakes up in the morning, he has enough T3 to power him through the day, and if by chance there is a need for more thyroid energy, he will convert his inactive T4 into the active T3. Review: free versus bound. A free hormone is an active hormone doing its work. A bound hormone is the same hormone as the free one, but it's attached to a carrier protein, making it inactive. It needs to be freed from the carrier protein to be active. When it comes to thyroid testing, we want to know what the free T3 is, not the total T3. The total T3 is the combination of free T3 plus bound T3. Again, we are interested in only the free T3. Saliva tests, by definition, give us exclusively the free hormone particle, in this case, free T3. Saliva testing is superior because it gives us tissue hormone levels and not the level of the hormones in the blood vessel. If only blood tests are available, you must insist on getting the free form of the hormone. But if saliva testing for thyroid hormone is available, that would be better. If a person does not have thyroid symptoms, then being anywhere in the normal range of the thyroid blood test is fine. If a person has the signs and symptoms of low thyroid function, but their tests are normal, our job is to question what is normal. The conventional doctor refuses to treat a symptomatic patient if their thyroid tests are just borderline normal. On the other hand, we realize that these patients will feel much better if their T3 will be in the upper 1/3 of the normal range. It's less important for T4 to be there because it's the inactive form of the hormone, but if it is in the upper 1/3, that's fine. A TSH that is 2 or above gives us the green light to consider adding thyroid medication if our patient is symptomatic. The conventional answer to hypothyroidism, even if the T3 is low, is to give L-thyroxine, Synthroid. It's just T4. Conventional medical practitioners expect the patient to get as much of the active T3 that they need for their daily requirements by converting it from the inactive Synthroid, T4. In reality, the lab tests will show that the patient's thyroid levels have returned to the normal range, low normal. But when you ask the patient how they feel, it is usually far from as good as they used to feel. They haven't lost the weight that their diet and exercise should have achieved. They might still have constipation, be moody, and have low energy. The BHRT approach says to give the patient what they're missing. Give them T3 or T4, or both T3 and T4 if they need it. It makes sense to me. Key point: why are most people who have thyroid problems women? It must have something to do with their hormones. Estrogen inhibits the thyroid, and progesterone helps the thyroid to function. And there is a lot of estrogen dominance going on. If a person has balanced estrogen and progesterone, they would less likely be found to have abnormal thyroid function. If the woman were estrogen dominant, having much more estrogen than normal, she might be setting herself up for abnormal thyroid functioning. When conventional doctors only look at the thyroid abnormality and don't see the interaction of the other hormones, they miss a possible reason, the ongoing cause of the continuing thyroid abnormality. The BHRT approach will have us look at all of the hormones. Yes, we will give the proper thyroid treatment, and we will also be working to re-establish balance between estrogen and progesterone. Autoimmune thyroid disease are Hashimoto thyroiditis and Graves' disease. For some reason, the body is making antibodies against itself. Most thyroid abnormalities are due to autoimmunity. Whether the disease manifests itself as lupus, rheumatoid arthritis, multiple sclerosis, scleroderma, sarcoidosis, or any of the other autoimmune illnesses, we have a chance at decreasing the severity and even resolving the illness if we take the holistic approach. The thyroid is the main player in Hashimoto and Graves, and it is most likely involved in all autoimmune illnesses. As BHRT practitioners, we follow the credo of making peace in the body, mind and spirit, dousing the fires of inflammation, uncongesting congested organs, bringing hormones into balance, and not leaving until normal physiology reigns. Since 70% of the immune system is lining the digestive tract, an autoimmune illness may find its roots in an abnormal bowel. Doing a comprehensive stool test along with saliva hormone testing for the sex hormones and adrenal cortisol levels will give us the information to put all of the pieces of the puzzle together. Another reason for abnormal thyroid function and even autoimmune disease can lie in the fact that the thyroid is so vulnerable to damage from chemicals like fluoride, chlorine in cleansers, and other damaging chemicals. Chemicals in plastic wrap are hormone disruptors in our food chain and environment. Even today, the long band DDT is still in our food, disrupting our hormones. Numerous chemicals have been released into the environment despite not having been tested for their ability to disrupt hormone functions. The thyroid that sits close to the surface of the body is also quick to experience damaging radiation from cell phones, computers, car dashboards, etc. A damaged message relay center is a serious problem for optimal hormone function. There is a thyroid-cholesterol connection. In the not-so-distant past, when patients couldn't afford cholesterol blood tests, doctors used a more affordable test called the poor man's cholesterol test, the TSH. It was a well-known fact that when an underactive thyroid's TSH went up, so did the level of cholesterol. In fact, the treatment for the elevated cholesterol back then was to fix the thyroid. The sluggish thyroid was also sluggish in commanding the liver to sufficiently process cholesterol. I'm not sure the drug companies will be thrilled if you work to improve your patient's diet, exercise, bowel movement frequency, estrogen and progesterone balance, and treat their sluggish thyroids. If you do that, your patient may not need their statins. There is a Thyroid-Adrenal Connection. You can bet that when the adrenals are affected, the thyroid will be too. The two are that well connected. Helping the adrenals will frequently cause a natural improvement of the thyroid without too much intervention. Consider the thyroid like a foot on the gas pedal. You push the gas pedal down and the car goes forward, but only if there's enough gas in the tank. The adrenal cortisol is the gas in the tank. Therefore, it's important to support the adrenals if you are treating the thyroid. There are different ways of addressing adrenal thyroid needs. You could treat the adrenals for a month, which is equivalent to filling the tank with gas. In reality, it could take a lot longer to fill the tank, but at least you are getting the process going. Then, at the end of that month, if the person still has their thyroid symptoms, you could add thyroid treatment. Some people begin both treatments at the same time, starting with a low dose of thyroid medicine. If a person pushes the gas pedal too hard, gets too much thyroid medicine without enough gas in the car, meaning that the adrenals are empty, the car will shake. Actually, your patient will do the same and feel really bad. There is a Thyroid-Iodine Connection. People need 1 milligram of iodine per week. Iodine is a building block of the T3 and T4 molecules. A deficiency of iodine can cause an underactive thyroid. In the continuum of thyroid illness, an underactive thyroid starts to puff up or become a goiter as it tries to best utilize its tissue. There is a major problem with this approach of treating thyroid problems with hefty doses of iodine. There may be improvement in a person's condition, but too much iodinated thyroglobulin will trigger autoimmune antibodies. People with autoimmune disease should avoid iodine. It is technically difficult to measure a person's iodine level, so it isn't done for practical reasons. It is much easier and more accurate to measure the free T3 and free T4. I personally feel that overdosing with iodine, as is sometimes suggested in the popular press, is dangerous. I have been very satisfied with my results using standard supplements with the fixed amounts of iodine or with standardized thyroid glandular products. Estrogen increases thyroid-binding proteins, and that makes less active thyroid hormone available. Someone on thyroid medication who then receives estrogen for the treatment of menopause will likely need more thyroid medication. Sometimes the affected woman may need almost twice as much thyroid medication. Someone who is borderline low thyroid and put on estrogen can be kicked into hypothyroidism.